A painful condition known as shingles is increasing in the United States. A study by the National Centers for Disease Control and Prevention shows a 39% increase in reports of shingles since the early 1990s. There is no cure, but a vaccine is available that can significantly reduce the chances of avoiding the condition that now affects up to 1/3 of all American adults.
Christina Wynn is one of a million Americans who will come down with shingles this year. Christina went to bed one night last June feeling fine, but woke up the next morning with what she describes as a blotchy red rash on the right side of her arm and along her rib cage.
And it got worse the next morning because it starts out looking just like a rash, and then the next morning it actually looked like chicken pox clusters. But they were way more painful, and it wasn't as itchy as when you have chicken pox.
Christina says on a scale of 1 to 10, the pain from shingles ranked at the top of the scale.
Like the 8, 8, 9, maybe 10 if you just try not to touch it or scratch it, or else you'll get scarring.
Shingles is caused by the same virus that's responsible for chickenpox, which about 95% of Americans over the age of 40 have suffered. The virus never leaves, staying in nerve roots near the spine. Aging weakens the immune system and makes it easier for the virus to reactivate, traveling through the nerves to emerge on the surface of the skin. Symptoms of shingles include a painful rash or blisters, fever, headache, and chills. Those most susceptible to shingles include anyone who's had chickenpox, older adults, and those with weakened immune systems. It can also be triggered by extreme emotional or physical distress. Christina says she had to take more than a week off to avoid infecting young patients at Children's Hospital in Oklahoma City, where she's employed. Even without the risk of contagion, she doesn't believe she could have gone to work.
I don't think so. You couldn't concentrate, and you get a cold, flu-like symptoms, and you just want to lay in bed all day. You can't do anything.
Susan Mendes is the education director for immunization at the State Health Department. Mendes says the end of the rash is not necessarily the end of shingles.
Usually the rash lasts 2 to 4 weeks, but then 1 out of every 5 people who get shingles can develop what is called post-herpetic neuralgia, and the pain continues for a year or longer.
Christina was lucky. She didn't suffer any lingering pain, but her outbreak still lasted several weeks.
The process of it just coming up and then starting to blister and crust over is about a month, but for it to actually completely go away and your skin go back to normal, it took me close to 2 months, and I still have some scarring where my clothing kept rubbing on my backside.
The affliction can also cause other, more serious health problems.
Shingles can lead to blindness, hearing problems, inflammation of the brain, and even death. So the vaccine is worth it to prevent, maybe it will prevent shingles altogether, but it's worth it to prevent the complications and reduce the pain.
The vaccine she's referring to is Zostavax, which has been available for the past 7 years. The vaccine's recommended for persons aged 60 or older and reduces the risk of suffering an outbreak of shingles by about 51%.
It will probably reduce the pain, though, for other people who get shingles after they've been vaccinated. So shingles won't be as severe if you've been vaccinated.
As with any vaccine, there are some people who should not receive it. That includes anyone who's previously had an allergic reaction to any of the vaccine's components.
For a shingles vaccine, that includes the antibiotic neomycin and also gelatin. So if you've had any severe allergic reactions to any medicines in the past, you should definitely tell your healthcare provider about that before you receive the vaccine.
Others who should avoid getting the vaccine include persons with weakened immune systems due to HIV or AIDS, treatment with drugs that affect the immune system, cancer treatment such as radiation or chemotherapy, cancer affecting bone marrow or lymphatic systems, and women who might be pregnant. Despite its effectiveness, only about 10% of Americans are getting the vaccine. Cost may be an issue. The price of the vaccine is about $165, but Mendes says it is usually covered by most private health insurance plans.
It's also covered under Medicare Part D. Now, you may have to pay a certain portion of the cost of the vaccine, or you may have a copay, depending on your Medicare Part D plan. Also, for adults who cannot afford the vaccine manufacturer, Merck and Company, has a patient assistance program, and you can go to Merck.com website and find out about help available for paying for the vaccine.
The vaccine is available at most county health departments, many drugstores and pharmacies, and through your regular health care provider.